While Nigeria basks in the euphoria of recording a one-year polio-free status, the big question is, can the Nigerian government sustain this clean bill of health before the set date of 2017 by the World Health Organization? Welcome to Question Time. I'm Benga Ashiru. You may join in this conversation by sending us your comments on our various social media platforms showing on your screen. After years of intense advocacy, religious dispensing of polio vaccines, and mounting up of close surveillance in its anti-polio campaign, the Nigerian government finally got a reprieve after recording a 1 year without a reported case of polio. Nigeria now looks ahead to 2017 when it intends to get a full certification and delisted from the list of polio-infected countries. Tensions are running high on the chances of Nigeria in sustaining its polio-free status for the next 2 years. Channels Television was at the National Primary Healthcare Development Center, where we met with the CEO, Dr. Mohammed. He says the federal government is mounting a polio foolproof plan to ensure the polio virus remains completely wiped out in Nigeria.
Let me start first by congratulating Nigerians, including you, on this major achievement, which is unprecedented in the history of public health in Nigeria. For us, it's been 1 year when we last saw a case of a polio virus in Nigeria, which means it's a year since a child has been paralyzed in Nigeria. The last case was in Somalia local government area of Kanu, in a 16-month-old child. It has a lot of significance. First, Nigeria will be removed as a polio endemic country by the time the pending samples at the lab turns negative. Secondly, no child has been paralyzed in Nigeria in the last 1 year. That will remove a lot of burden on the parents, because parents normally go through a lot of agony when their children are paralyzed. Then thirdly, we've restored confidence of the global community in Nigeria that yes, Nigeria can do it, and we're very happy with the progress, and we intend to sustain this zero polio case status of Nigeria up till 2017. This is a major milestone that Nigeria have attained.
But doesn't this call for caution? Because if a case is not reported, does that sufficiently mean that there are no hidden cases, perhaps unreported?
Let me perhaps, if I take you, provide some background, you understand the protocol when it comes to WHO, times like elimination, like interruption, like eradication. If a country attains a year without a case, in the case of polio, if a country attains a year without a case of polio virus, any child being paralyzed in 1 year, then that country will have been said to have interrupted transmission of the polio virus. Nigeria is now 1 year without a case. We are very optimistic, but cautiously optimistic. And we will continue to do those things that we've been doing that have taken us to where we are now. And the cases, if there's any case of polio virus in Nigeria, Benga, I want to assure you that our surveillance system will pick it. So it's not as if there are cases and they're not being reported. And when there are cases, we said there are cases. So if now we said there are no cases, why won't you believe us? Why won't Nigerians believe us?
So what were the factors that accounted for the drop in polio cases in Nigeria?
Yes, there was a massive drop in 2010, and then there was resurgence again of cases in 2011. But from in 2011 and then 2012. But from 2012, we've seen gradual, consistent reduction of cases. In 2012, we reported 122 cases. In 2013, 53 cases were reported. In 2014, only 6 cases were reported. And this is not just by chance. First, we've brought in a lot of innovation into the program. Secondly, we also introduced accountability into the program. And then we made effort to reach each and every settlement in this country. In 2012, as part of the innovation, we brought in accountability.
Now, tell us about this surveillance system. You seem to have much faith about this surveillance system.
Yes, the surveillance system is being operated outside the control of the government of Nigeria, and is being managed by World Health Organization. And in every local government in this country, the World Health Organization has a DSNO officer, that the surveillance notification officer, who reports back if there are cases of poliovirus. And before now, we've been relying on health workers to report. But we've activated the surveillance system, improved the network to also bring in better medicine vendors, bone setters, traditional birth attendants, and also doctors in hospitals. Because sometimes if a child has weakness of the limb, the first place a parent take that child to is a bone setter or a traditional healer. And so all those sources, possible areas of unorthodox management of cases, have been activated and co-opted into as part of our informants for the surveillance system. And if you look at where we are with the surveillance system in Nigeria, in 2011, the surveillance system was just about 65% sensitive. But by end of 2013, our surveillance system is about 85% sensitive, and it's improving. And in fact, Nigerian surveillance system is being adjudged as one of the best within the polio-endemic countries. And don't also forget the fact, Benga, that our surveillance system was also used for contact tracing during the Ebola outbreak in Nigeria. So we're very optimistic of our surveillance system. If there's any case of poliovirus in this country, our surveillance system, which is being managed by WHO, will be able to pick it within 48 hours, and then we'll get feedback. We'll get informed. So when we say there are no cases, there are no cases. If there's any case, we'll pick it. And when there are cases, we say there are cases. So Nigerians should believe us now if the WHO said there are no cases in Nigeria.
You can join in this conversation by sending us your comments on our various social media platforms showing on your screen. Coming up on Question Time, how strong is the anti-polio surveillance system? Find out when we come back in just a bit.